Hi, my name is Nikita Davidenko, and this summer, as part of the SEO program and part of the Ramirez lab, I worked on investigating the potential benefits of dexamethasone in the regeneration of bone marrow due to the side effects of the aging vasculature by chemotherapeutic treatments in AML patients. First, it's important to look at AML or acute myeloid leukemia, which arises from myelodysplastic syndrome or MDS. MDS negatively affects cells, or more specifically, immature blood cells, by making it so they do not mature well, which results in a lack of normal cells as well and often red blood cells. MDS and therefore AML is known to be increasingly more common and deadly in older patients. In fact, the 5-year survival rate of a patient generally with AML is 28.7%, or to put in perspective, almost a third. More generally, chemotherapy is the cause of death for more than 25% of cancer patients. Here you can see two images of AML in cells. Here's a histopathology image, and more generally just an image, just to put a picture to the words. Next, it's important to look at the bone marrow vascular niche. Bone marrow stem cells, they reside in a pretty important niche as they receive signals from endothelial cells that are important for the regeneration of the bone marrow, in addition to the proper production of blood cells. The bone marrow niche, for this reason, has to be able to regenerate properly after cancer treatments that affect it negatively. It's important to consider the effects of chemotherapy not only on the blood cells, but also the microenvironment. As you can see here, these are blood vessels that were treated with 5-fluorouracil, and at day 0, the blood vessels are fine. At day 4, they seem to have, some of them disappeared, and at day 7, they're much more dispersed and seem to be broken up. Next, it's important to look at the hypoxia-inducible factor, an oxygen-sensing transcription factor that has been seen in lab to degrade in the vasculature of older and compromised patients. As you can see here, under normal oxygen conditions, HIF-alpha degrades, whereas under low oxygen conditions, HIF-alpha joins ARNT or HIF-beta to form a heterodimeric transcription complex that's important for creating various genes, one of which is VEGF, which makes blood vessels. In addition, 5-fluorouracil, the chemotherapeutic drug, has been seen in lab to have toxic effects on ARNT knockout mice. Here you can see, in terms of 5FU treatment, control mice with ARNT survived after 50 days. On the other hand, ARNT knockout mice all died off at around 21 to 22 days. Finally, it's important to note that there's been seen to have poor bone marrow recovery in 5-fluorouracil treated ARNT knockout mice. In this left image, you see the control mice which have a well-constructed endothelium, whereas on the right side, in ARNT knockout mice, the endothelium seems to be broken up at various points. In addition, when you're looking at cell counts, the bone marrow cell counts of ARNT knockout mice are lower than control, as well as their endothelial cell counts. For my project, the goal is to continue examining how protecting this endothelium in patients that are older could favor their recovery when undergoing chemotherapies related to blood cancers, such as AML. In terms of materials and methods, we would be having control and conditional endothelial HIF-deficient mice that at 16 and 36 weeks would be treated with 5FU with and without dexamethasone, and their survival after this would be monitored by a day-to-day basis. In this figure, you can just see how ARNT is genetically knocked out in mice. In addition, femurs would be isolated at both 7 and 14 days following their treatments and processed to examine their overall vascular structure in terms of their bone marrow and regeneration of that. In terms of expected results, we're expecting that treatment with dexamethasone would benefit the overall survival of compromised endothelial HIF-deficient mice, meaning that, as you can see here, 5FU negatively affects it by destroying many of the cells. But we're hoping with dexamethasone that there would be more regeneration of various features you see on the left side. In terms of conclusions, the next step is to determine whether the dexamethasone treatment in endothelial cell HIF-deficient mice with AML from 5FU chemotherapies could improve their survival. AML would be introduced to the mice by the adaptive transfer of hematopoietic cells virally expressing an AML or AML-like gene. Analysis such as these would help us determine if treatments with anti-inflammatory drugs could help the regeneration of bone marrow of AML patients, more generally, human AML patients, mostly compromising the aging population with reduced endothelial HIF activity. Finally, I'd like to thank Dr. Ramirez, Dr. Berger, and the SEO